Okay, this video is hypertension treatment a joke? So we're going to just talk about a practice patient. All right, so this is a common situation. Patient came into the emergency room 2 weeks ago, was severely hypertensive, let's say 230 over 110, systolic 230, diastolic pressure 110, was treated emergently, blood pressure was stabilized, and now the patient's coming back to you for a follow-up visit in your clinic as an outpatient. Today's blood pressure is still a little high, 155 over 85. What do you do? So you open up the internal medicine cookbooks, Scut Monkey Handbook, and it says something like this. Hydralazine vasodilator, 25 milligrams 3 times a day. Isosorbate dinitrate, another vasodilator that increases nitric oxide, 20 milligrams 3 times a day. Amlopidine, calcium channel blocker, 5 milligrams once a day. Losartan, an angiotensin 2 receptor inhibitor, 100 milligrams once a day. And then, Coreg, carvedilol, beta blocker medicine, 50 milligrams twice a day. That's a pretty standard blood pressure protocol. And don't get me wrong, there's lots of different cookbook versions of it, and that's all fine, well, and good. But do you notice anything missing with this treatment plan? I don't know about you, but I don't see anything about a low-fat, low-sodium vegan diet with no oil. I don't see anything about Dr. Kempner diet. Dr. Walter Kempner was famous as the best doctor in the whole world for treating hypertension for multiple decades, 1940s, 1950s, 1960s, a little bit in the 1970s as well. Here's the biography of Dr. Walter Kempner by Barbara Newbark. She's a doctor who worked with him. He put patients on a rice diet based on white rice, which has only 1% of its calories from fat. You want to lower the fat as much as possible because fat sticks red blood cells together, makes the blood thick, causes the pressure to go up. He also dramatically lowered the patient's dietary sodium. He had incredible results. It was pretty routine for him to get people with systolics in the 200 down to relatively normal blood pressures with systolics like around 130 and so. Wouldn't that be easier? Imagine you're the patient. Wouldn't it be easier to eat a low-fat diet and have to remember to take all these pills today and have to have all the potential side effects of these pills? So that's my point. I've never in my life heard anybody mention the name Walter Kempner until I heard Dr. McDougall talking about him. This is the book. You'd have to buy this book, Barbara Newbark's book, but you can just go to Dr. McDougall's website, drmcdougall.com, and you could go into the Walter Kempner section, and you'll see Walter Kempner's book, the one Kempner wrote himself, where he talks about how he treated his patients, why he lowered the dietary fat, lowered the dietary sodium, monitored the dietary sodium. So that's why I meant by, is hypertensive treatment a joke? And in my opinion, if you don't recommend a low-fat diet and a low-sodium diet and avoiding oils, then it's kind of a joke. Then it's not, it might be standard of care, the lowest common denominator, but it's not optimal care.